Hey, how are you? Well, how are you? Yeah, yeah.
Good to see you.
I don't see that.
Okay.
How much you got it?
Fine, Dylan. Okay. Jeremy, how much were these again? Last time I checked? Around 35. So around 35, so about 10K.
Looking at the watch, my watch anyhow, that's 11 o'clock. It's time to call the meeting to order. Please ask that you turn your phone to vibrate or turn them off or silent mode. See, got a couple members of the public here. Just if you would, if you wish to speak to any item, please come up and fill out a card. See Miss Tina here and fill out a card where we can have your name and address and such. And you will be limited to 2 minutes speaking. Thank you. Okay, with that, let's stand and say the Pledge of Allegiance, please. Pledge allegiance to the flag of the United States of America and to the republic for which stands one nation, under God, indivisible, with liberty and justice for all. Okay, does everybody have a chance to look over the minutes from last meeting? And if so, I entertain a motion to pass.
I make a motion that we accept the minutes.
Okay, second?
Second.
All in favor, aye? Okay. Moving on with the agenda here, Ms. Gillum from United Way, I think you have you here first to give us a presentation for us, please. Thank you.
Sure. Thank you for having me today. For those of you I've not met, I'm Laura Gilliam. I'm the president and CEO of United Way of West Florida. And I just wanted to share some information that I thought might be helpful. Dr. Williams and I have worked together for the last year or so on the, or gosh, it's been longer than that, on the mental health task force. And so we've had some conversations about this. So I've been here since 2018. I moved here from Huntington, West Virginia. And I was with another United Way of River Cities in Huntington for 12 years. And for those of you who may not know, Huntington, West Virginia, unfortunately, when I moved here, was known as the overdose capital and the opioid capital of the world. That's not a really good title to have. The last 2 years before I left, we spent a considerable time on substance use disorder related issues. We had a youth prevention coalition that was established in 2005, and one of the things that I learned about being part of that program is the need to ensure that the community is ready for programming, whatever it is that you're trying to implement before you implement it. Because if they're not ready, if they don't recognize the problem, if they don't understand the problem, then they're going to have a hard time accepting it and agreeing to some of the programming and the solutions. So for anybody who was in Huntington in August, on August 14th of 2016, that's a date that's just kind of burned in our memory. There were 28 overdoses in the span of just a few hours in a very small geographic region. And just to give you a little context, Huntington is maybe about the size, maybe actually a little bit larger than Pensacola, but our United Way served a 5-county area, one of which was in Ohio. That entire 5-county area population is the population of Escambia County. So very rural, very spread apart. But just on that one day, in that short span of time, there were 28 overdoses. Now, that just kind of rocked everybody's world, as it should. And I'm telling you this just to give you some perspective. You all are much better experts and are experts on this. I am not. This is not my line of work, but I was thrust into learning about it and working on solutions because of what was happening in our community. And I'll admit, I'm having a little bit of deja vu right now. Some of the headlines that are coming out in the PNJ, some of the conversations that I'm having, some of the things that we're hearing from some of our partner agencies is alarming. So what I'd like to do today is to give you, as quick as I can, an overview of some of the solutions that have worked, some of the things that have worked in Huntington. Again, this was 2016, which was kind of the red letter day, and by 2018, they had made some market improvement in that issue. I'm sure and I know that many of these things or similar things are being done in this community, and I'm not really here to say this isn't. I'm just telling you this is a community that was having a hard time and found a way to come together to create some solutions. Lots of the information and the resource materials that I reference, I have copies of, and I'm happy to pass it along. One of the things that you might hear me say, if I don't, it's just because I've skipped over it. A lot of what Huntington did was to look at other communities to find out what was working there. And I know that's happening here, but I can't emphasize enough the importance of looking at what's working someplace else, bringing that here, figuring out how it's going to work in this community. And again, keep in mind that what you're hearing about happened at a time when there was very little money for treatment, for intervention, and for prevention, much, much less than what's available now. So just also keep that in mind. Again, what they did wasn't perfect, but I'll tell you that between 2018 and 2019, there was a 40% drop in non-fatal overdoses and a 20% drop in fatal overdoses. So something was working. So the very first thing that they did after August 14th was to convene leaders. And I mean leaders from everywhere, from local government, law enforcement, faith-based, hospitals, medical community, across the board. And they got really hard and fast into community-wide discussions. And what they found was that there were a lot of groups that were working independently. A lot of work was going on, but it wasn't coordinated. And so that resulted in a lot of duplication of effort and an unintended waste of resources due to some overlapping work that was occurring. And so what resulted then, and one of the reasons I think they've been able to move forward, is that out of that came this unified collaboration and this agreement that they had to work together. And that might mean that some entity had to give up a little bit for another entity to do this or to come together as a group. But in the end, that has been recognized nationally and internationally as a success. And that is the one big thing, that is one of the big things they say has worked, and the reason that this community has made some strides. There was an initial attempt to get some of this under control through law enforcement, which is a reasonable and rational thing to look towards. But every time they would raid a drug house, there'd be another drug house that was opening up. So, even though in a 3-month period of time they had arrested over 220 people, it just still kept cranking. So law enforcement was part of the solution, but it couldn't land in their lap entirely. So what ended up happening was that the mayor of Huntington started to go on these raids. And so he started to see what was happening. He started to see the people who were suffering. And so he got a firsthand look at what was happening in his community. And out of that, he formed the Office of Drug Control Policy. And that included existing law enforcement, fire department, seems to me there was one more, to look at what was going on in the community. At the same time, Marshall University, which is the major institution in Huntington, developed a campus-based coalition. So these were working in concert. And the most important first step that they did was to collect data, and the right data. They wanted to know what were the substances, how many people were struggling, the cost, which is exceptionally important, and I'll mention that in a little bit, the overdose numbers, the overdose deaths, where the geographic centers were, and then out of that, they developed a comprehensive database. One of the things I remember them saying is that they found that some of the data that was being reported by the medical examiner's office there, not here, there was not listing overdose deaths. They were listing something else. So there was some conversation that had to take place with some of these entities that were reporting the deaths because they weren't reporting it. They were reporting it accurately, but it wasn't helpful the way it was being reported. So they had to get down to why was there a heart attack or why was there a drowning? Well, it was because the result of an overdose. Marshall University was a key partner. They provided evaluation of grants, they hosted trainings, they provided counseling on campus, they trained future behavioral health workers, so they were a key partner. Lots of departments and colleges got involved. One of the advantages up there that they have is that there's a med school and a pharmacy school that are associated with Marshall. But even so, they got the psychology department, social work, counseling, public health, all of those involved. So just because there's not a med school and a pharmacy school here, that doesn't mean that we couldn't get UWF involved heavily if they aren't already. At the end of the day, they formed the Division of Addiction Sciences in the Department of Family and Community Health. And at the end of the day, after that first convening, gathering data, they decided that the focus was on keeping people alive. Prevention was important, and I'll talk about that in a minute, but they needed to make sure that people weren't dying. So some of the early interventions, law enforcement, again, was overwhelmed, and so they had exhausted their resources. So one of the things that they did that did involve law enforcement was called a LEAD program, and that embedded a mental health provider to provide pathways to treatment. So they would go out to the homes with a mental health provider, and as a result, over 50% of the individuals who were contacted entered some form of treatment. And what that did was increase access to these people who needed help, but it also normalized having a mental health professional within law enforcement. Harm reduction. One of the things that you know about IV drug use is that often leads to other public health emergencies like HIV. And one of the things that that Huntington did not want to be known for was to be another Scott County, Indiana. They had high IV drug use, and that resulted in a huge HIV outbreak. So harm reduction was the next step. The Cabell Huntington Health Department opened a harm reduction program. It was the first in the state. It combated substance use disorder and protected public health by incorporating peer recovery specialists. It drew people out of the shadows and provided this essential access point. And it was a needle exchange. They were having people come in who were using needles, and instead of discarding them in the parks around our building where my office was, they were bringing them in, and while they were in there getting needles, they were meeting with these people, developed a sense of trust, and eventually found their way into treatment. And as a result, it was through that work that they discovered a cluster of HIV and were able to begin to address that. If they hadn't done the harm reduction program, I don't know that they would have captured that. So treatment. MAT, I know we have that. That's a big thing in communities. It was a big thing there, but it was all outpatient. And so the challenge, what happens when somebody who has substance use disorder goes into a hospital? So they started Project Engage. And so when someone enters the hospital, they're screened. The hospitals then invested in recovery coaches in the emergency departments and inpatient floors, as well as addiction specialists. So they were able to treat these folks when they were in the hospital, as opposed to that being kind of an issue that they were trying to work around. They established a maternal addiction recovery center at one of the hospitals that provides comprehensive obstetrical, outpatient care, outpatient addiction care, and counseling for expectant mothers with opiate addiction. They also, that's actually not at the hospital, I'm sorry, that's separate, that's outside. Within the hospital, there's maternal opioid medical support program called MOMS, and that provides substance use recovery support for both postpartum women and babies, and it's in the hospital near the unit that takes care of the exposed babies. Another thing that they recognize is that you can get people through treatment, but to put them back into the communities they came from is often an issue, and that often there's relapsing. Project Hope is a residential treatment program that encompasses all pathways to recovery, and that's for women and their children. As a result of a lot of this collaboration, they started to discover a significant gap in the continuum of care. And so in 2018, they opened something called PROACT, which is Provider Response Organization for Addiction Care and Treatment. That's an outpatient treatment facility that allows immediate access for individuals struggling with addiction, and it covers all models of treatment, all forms of treatment. They partner with 5 organizations, the med school at Marshall, both hospitals, the federally qualified healthcare clinic, and a hospital in Charleston, West Virginia, which is about 50 miles away. And it addresses the barriers medical providers may face when trying to provide care. Now, at a community level, some of the things that they did was SBIRT, Screening, Brief Intervention, and Referral to Treatment. That was coordinated through the university. They trained at this point, which was 2020, they trained over 4,000 people. So it's not just people who were, in the field, but it's also people like me. I went through it. So it's anybody who could be trained in that. Faith leaders, they established Faith Community United, which was a series of training sessions that started with a convening of the faith community to say, what is it that you need? These are people who are experiencing, their congregation members are experiencing deaths. They don't know how to handle families that have people who are addicted. They were struggling, and the first thing we did was to sit down and say, what do you need from these folks? And that's been an incredibly successful training program. I have that information, and it has resulted in that community kind of stepping outside of its comfort zone and providing a huge level of support to the folks in that area who are in recovery. Healthy Connections, that's treatment of mothers struggling with addiction and the well-being of their families. 20 different partnerships are involved in that program. There's a program around recovery employment. They were finding that people were having a hard time accessing employment, and so they started out with a survey to survey the business owners to find out, kind of what was their overall approach to hiring somebody who was in recovery. And at the end of the day, they developed a program that focuses on individuals becoming workforce ready, supporting those businesses and becoming recovery-friendly employers, and then expanding the workforce through social entrepreneurship opportunities. One of the other things that they dealt with was compassion fatigue. So if you're in law enforcement or if you're an EMS worker and you're going out in the morning and you're dealing with somebody who's overdosing, and then you're going back out at 5 o'clock in the afternoon and it's the same person, that'll get to you. And so that was another thing that was starting to really permeate first responders, and so that's an issue that was addressed. There have been several different ways that they've been working on trying to address that, and they've had some success in that as well. But just even recognizing it in the first place, I think, was an important step. The Cabell County Substance Abuse Prevention Partnership, that was the youth prevention partnership that was part of United Way when I was there. They had monthly meetings. The focus was on developing a coalition within the local school district of youth, so that these were youth who were working with youth. They had an annual drug summit, which focused on education and outreach. They promoted and led drug take-backs. We had drug take-backs at my office. It's amazing how much medicine that people don't use anymore that they keep in their cabinets. I mean, we had bags and bags of that stuff that people were dropping off. We coordinated spot checks to businesses that were selling alcohol and cigarettes, because those are gateway drugs to underage individuals. And so we would send people in, young people in. They went with somebody. My son ended up being one of them. He's in intelligence now in the Navy. I don't know if that had anything to do with it. But anyway, he is, that was one of the things that CSAP did. And then raise awareness of community petitions that change local laws for the better. And then in 2019, that actually expanded. It became the Prevention Empowerment Partnership, and now is more of a regional as opposed to a county level partnership. So the lessons that we learned, there has to be collaboration, and leadership is critical. If you want to talk to somebody who just headed out there ahead of everybody, took that community along, that's Mayor Steve Williams. He's the mayor of Huntington, and he had not been mayor for very long when all of this hit the fan. I have great respect for him. He did an excellent job of pulling that whole area together and has been recognized at a national level for his leadership. Data. You have to have the data. You have to have the right data. If you can't get the right data, you got to find out how to get it. And again, like I said before, there were conversations with providers of data about overdoses and deaths, and they were doing the right thing, but the information that they were providing wasn't necessarily that helpful at that time. So they were able to rework some of that, and they began to get the data that they needed. To bring people on board, you either got to pull at the heartstrings or you got to pull at the purse strings. Some people are going to be motivated to support this work because they see somebody struggling, they have somebody in their family struggling, they know what it, how bad it is, and so you tell those stories, then you can bring them in and have them support this effort. Some people that's not going to make any difference to, but if you start talking about dollars, you start talking about how much it's costing first responders, how much it's costing in this community, how much it's costing employers. When you have an epidemic like this in your community, that will hit home with another group of people. You got to deal with both as you're going through this. I thought this was really interesting. When I was reading through this, engage community members who might initially be opposed to an idea. Don't necessarily do it in a large setting, but in small settings so that you can sit down and talk with them and find out what are their concerns. Address some of those, and at the end of the day, you're going to bring people along as they learn, as they get past the rumors and the myths and learn exactly what's going to happen and how it's going to be part of the solution. The faith community was one of the best resources for gaining community support and involvement. I mentioned earlier the training that we did. That was largely one of the reasons, but as this book chapter says, they actually ended up going beyond their comfort zone and being an excellent source of support within the community to turn things around. And you got to have a plan, and you got to have everybody at the table, all parties at the table. There are some who are logically going to come to the table, but you got to think beyond that and bring the others to the table. But you had to have a plan. They had a plan. And you got to remember, too, they were kind of building the plane while they were flying because, again, this was happening and they were just trying to save lives. So I get the feeling in this community that there's a lot of really good stuff going on, but I don't know if everybody's at the table, and I don't know if there's a plan. And I'm afraid that there's some duplication of effort. I feel like there's some gaps, and I feel like there might be some unintended waste of resources. And again, I'm not trying to sound harsh. I think that's something that we've got to find out. Is that happening? And the way to do that is to make sure that we're pulling everybody together and develop this plan. What do we want this community to look like? What's already happening? What's not happening? How can it be improved? Or what do we need to put in place? And again, I just remind you that all of that I just went over, and that's the tip of the iceberg, was done at a time when there was very little money available to that community. And then I'll remind you that as of 2019, they'd seen that reduction of 40% in overdoses and 20% in fatal overdoses. So it can't land on the shoulders of one entity or one group. They were able to do it because that community came together and they had the leadership to do it. So that's an awful lot. I hope it was helpful. As I mentioned before, I've got a lot of reference material that I'm happy to share with you. I'm also happy to connect you with the people up there who have been on the front lines of this. To the mayor, to Lynn O'Connell, who was one of my big resources for this. I worked with her when I was up there. There's a whole host of people who have been intimately involved in this from the beginning and are still involved. And they're doing a great job, and they've got a lot of, they're happy to help. I've already reached out to them, and on more than one occasion, and they are happy to help. They would be a great resource. So that's it for me. I'm happy to answer any questions. I hope it was helpful.
Thank you. Thank you, Ms. Gillum, for your presentation there. It was very helpful. A lot of good information there and composed in a small capsule. Any questions of the board, Ms. Gillum, that you think of?
No questions, but again, I appreciate your presentation because I think it gives us some things to look at in terms of really what the role of this board is as it relates to how the funds are used and how do we best help the community in that regard. So thank you.
I do have one thing.
Sure.
Did they utilize any surveys for the community? How did they get community buy-in?
Yeah, surveys, community conversations. We hosted, United Way, the River Cities hosted a conversation around substance abuse. We had panel members, and then we did breakout sessions. We had 600 people in that room to talk about it. And so that was one of multiple conversations. So it was everything you could think of to get input. But the surveys were also a part of it.
Thank you.
Okay, no, nothing else. Ms. Gillum, again, thank you very
Sure.
much for your time and all the information you brought forward, and I'm sure somebody will be reaching out to you for some of the resources up there in Huntington, so thank you.
Absolutely. Okay, thank you for your time.
All right, next on the agenda, we have a presentation or a request from the Sheriff's Department. Chief Simmons, or Sheriff Simmons?
Thank you, Chief Mathis. Good afternoon. Thank you guys for your time. Lori did a really good job of kind of giving you an idea of what we're seeing, but I can tell you from law enforcement standpoint, what we're seeing is at the bottom level. We're seizing fentanyl, and it's packaged for sale, but it's also hidden. So we deal with fentanyl all the time. Fentanyl dust, fentanyl in bricks, and fentanyl in pretty much every situation you can think of. So let me start with what our request is, so you understand when I give you the why. We are asking to purchase 14 handheld narcotics analyzers. They are a total of $490,000. And the reason we're doing this is because each one of these analyzers will analyze 498 suspected controlled substance in a single definitive test. Sheriff's Office personnel will be able to analyze key drugs of abuse, specifically fentanyl, and they can do it through plastic and through glass. And this is why it's important to us. We have, we just heard from Laura about the picture that we see here in Escambia County, and we got to get a handle on it. We've had 225 overdoses reported last year at the Escambia County Sheriff's Office. However, that's not counting the ones the Pensacola Police Department has responded to. That's not counting the ones that EMS has responded to. That's not counting the ones that self-drove or someone drove them to the hospital. So what you're seeing here is a lot. That number is nowhere near as high as it is, and we almost have one every day. These are overdoses. We go to probably over one a day overdoses, but they don't result in a death. So the reason I say that is because we're increasing our cooperation with our federal authorities. This is something that we have to hit with a multi-pronged approach. And so what we're doing is we're partnering with DEA, partnering with ATF, partnering with FBI. And so our investigation is going to come up. A couple months ago, we had a rather large fentanyl seizure, and I think at the time I made a mention that we seized enough fentanyl to kill for everyone from here to Defuniak Springs if it were brought down to that level. So we're using Narcan more. So the bottom line is fentanyl has become our #1 priority at the Escambia County Sheriff's Office. Because it is our #1 priority, we're targeting people that are bringing it in. We're targeting people that are selling it, the mid-level distributors, as well as those that are just selling it in a what we call a small environment, because those are the ones that end up getting someone killed because they've cut it and then no one knows exactly how much fentanyl is in a particular thing. We're also seeing a lot of pill presses. So what they're doing is they're getting the fentanyl and they're creating the pills with the press. What that causes, if we get there in time, is a lot of dust, pills that have just basically one pill may have too many parts per milligram, others not quite so strong. And then they crush them up again, and there's all sorts of powder, there's all sorts of residue, there's all sorts of dust. And quite frankly, we care about the men and women that work at the Escambia County Sheriff's Office and the canines that we're dealing with. The plan is to put one of these on every shift, and then we'll have one in our narcotics unit, and one also will be in our crime scene unit, because they always have to handle the fentanyl as well. We weren't sure that this would come to the market in time to save a deputy, and it looks like it's going to, if you guys will approve the request here. I've submitted also a request from the, not to you guys obviously, but the Pinellas Sheriff's Office, Pinellas County Sheriff's Office recently bought these, and they spent $625,000. They bought more than we have. We were in a couple of conferences, and the Attorney General came to us and said, if you're not trying to buy something for the protection of your law enforcement officers, then you're missing the boat. And they talked about the amount of money. I talked to Wes Marino, and he says, hey, you should probably come here to do this. Just for full disclosure, we did ask for an appropriation through the state. There's a bunch of different pools of money. You guys are probably more aware of it than I am. But we failed in that appropriation because they basically kicked us down and said that there is a board that we can go to a local board and make that request. So my request, again, let me reiterate it, please, is for $490,000 that will purchase 14 handheld narcotics analyzers. And again, it's as simple as that. It's as simple as we see fentanyl all the time. It's not like cocaine. It's not like marijuana. It will kill you. We have a Blazer Academy. My guys here will tell you, we have a Blazer Academy. We mentor 13, 14, 15-year-olds, and my only message is fentanyl kills. Fentanyl will kill you, because I know what they may not know, and that the joint that they get or the blunt that they get may not be just marijuana, and the cocaine that they may try to dabble in may not just be cocaine. This is not just for kids. This is for people that are over 60, not the kids, but the fentanyl itself that ends up taking a life. So with that, I think hopefully I'm pretty clear on the request. Hopefully I'm pretty clear on the why, and I would hope that that you guys would consider, funding this request.
Thank you, Sheriff. I have one question. It's kind of on a side note to that, but Ms. Gillum brought it up earlier. Do you know how the medical examiners reporting the deaths? Are they reporting them as overdose fentanyl in one category, or are you aware?
I can tell you that I've seen some of the toxicology reports, and a lot of them have cocaine and fentanyl, and then they have to wait for the parts per thousand type thing to determine which one it is. We're getting some of the information in our investigations, because there's a way that we can charge someone that may have given the fentanyl to them. In one case, we're looking at an individual. We arrested this individual. They brought fentanyl into the jail, gave it to 200 inmates. The inmate passed away. That's pretty easy for us to do it. So we are getting information. I don't know exactly if she's able to say fentanyl overdose, but my understanding is that that's what's happening. There's nothing else. It's a overdose, and then she lists 3 or 4 different drugs.
Okay, thank you, Sheriff. Also, I'm assuming that this is for down the road when it gets to county purchasing, but this is a sole source?
Yeah, it is right now. It's the one that, in fact, the one that I sent for you was the one that fits our needs the best, so it will be a sole source.
Thank you, Sheriff. Anybody have any questions for the Sheriff?
Thank you.
Appreciate it. Any discussion on the Sheriff's request, and are anybody want to make a motion on that?
I think we gonna get a budget update here shortly, so that we'll know exactly how much funding we're working with before we can actually make a motion on it.
2.5 million.
As of today. Okay.
Okay, thank you. This time I would entertain a motion to move forward with this process for the Sheriff's Office.
So moved.
Second.
All in favor? Aye.
Aye.
Okay, thank you. All right. With that, I see we'll move on to the next presentation. It'll be a budget update by the County Administrator, Mr. Marino.
Good morning, Board. 2.5, that's about what you have balance, and it's in the bank, in our account. We just checked last week, received an update. So that's it. It's 2.5 million sitting there.
And then, since we voted on this, you'll take it before the board for approval?
Yeah, we'll put a recommendation together to go to the 18th meeting.
Okay, the 18th, thank you.
Yep.
Thank you.
I have one question, I'm sorry. Sheriff Simmons, if you would, I have one question for you, actually two, if you would. Something just came to my mind, is something that we've been talking about here for the last few months, about priorities and things of that nature. And definitely law enforcement is definitely is a priority. When you, and you may not have these numbers in, right before you, but when you encounter these overdoses, what percentage you would say they're probably under the age of 18?
I would say that the most, I'll start the other way. Most of our overdoses are in their 30s. And then probably it breaks down from that point, or older and younger. I'll tell you a sad note. I told you that I was talking to the Blazer Academy. Every week I tell them, fentanyl will kill you, fentanyl will kill you. Well, between my 5th and 6th class, I had to tell them that my own brother-in-law overdosed on fentanyl, and he's 61. So the ages, go from 60s to 70s on down. I would say it's 20s and 30s is by far the biggest numbers that we see.
And at this time, what are you using right now to kind of like when you come on a scene to kind of like detect what type of narcotics it is before, you have to take it all the way back to the lab to kind of analyze it, or?
We have a field test that's really small, and John and Matt would know it, but it's a plastic piece that you got to put the actual piece of the drug in there. Hopefully you don't get it on your hands, and you almost always get it on your hands, even with gloves, and you're always smelling some parts of it. But the problem with that, what makes it worse is fentanyl. If you breathe in enough, that could kill you, as you know.
Right.
So we can do a field test on it, a presumptive test, but we don't have, with those new kits, we don't have to go there. It takes a picture of it, scans it, and it can let us know without having to open the bag for this presumptive kit. Now, eventually, it'll go back to FDLE for a real test, but we have a presumptive kit without having to touch the item itself.
Okay. Thank you, Sheriff.
Thank you.
Thanks, Sheriff. Have a request for presentations from Denise from CDAC. Please join us, Denise.
Not a presentation, just an update from the opioid summit that we did on this last Thursday. So part of what I gave you today was some of the questions that we asked the audience members during the summit, and it was some major concerns, solutions, and who should address the issue. This morning, I just sort of copulated some of the major highlights, and I handed those out to you. The other thing that I handed you out earlier was the sheriff was asked during the opiate summit about the fentanyl strips. And so that was a topic of conversation that somebody addressed to him. I gave you a sheet on what that looks like as far as what the CDC has reported out on what that is. Sounds like the sheriff's department has something that's much more comprehensive that may provide his officers more safety than just the fentanyl strip. Not during the opiate summit, but in conversation with people in recovery from opiate dependency. Now, it's not a whole wide of people that we have interviewed or I've had a conversation with. Fentanyl strips, they may have tested their substance before they used, but it wouldn't have mattered. They still would have used because addiction is a brain disease, and no matter what is in that substance, they will use. So when you're looking at harm reduction, yes, it could be a harm reduction for some people, but in the throes of their dependency, they will most likely use no matter what's in the substance, if you talk to somebody in recovery. Some positives that came out of the opiate summit is we had some great, phenomenal speakers, great feedback from it. The audience members learned a lot. So we had an addictionologist speak. We had several people in recovery speak. We had somebody speak on medically assisted treatment. David Tercel from EMS spoke, giving Narcan training. Sheriff spoke. Representative Salzman spoke. The mayor was there. Chief was there and gave the closing remarks. So I think from what I heard from the audience members, they'd like more involvement. Did invite the faith community. I'm not sure of the response that we got from them. In May, CDAC also hosted a opiate summit in San Jose County that was targeted toward the faith community. We had 35 people attend that one. We had about 165, I think, people attend the opiate summit this past Thursday. Somebody asked about data. So part of this abatement committee in partnership with other organizations is part of the role of CDAC as our opiate task force is to provide you guys data. So you asked the question on how does the medical examiner look at overdoses. So what they report out, and I don't work for the medical examiner, how they report it in their data is cause of death, like the drug cause of death, or fentanyl present at death, meaning that the sole cause of death was a single substance or it has a causal effect and there was other substances in it. Now, the last medical examiner's report came out in 2021, and I have to change glasses because I can't read. So for the age group 18 and below was 1. The highest age group with just fentanyl cause of death was age 35 to 50, which was 112. So hydrocodone, which is another opiate, under the age of 18 and below was 1, and the highest rate for that substance was 50 and older was 10. And fentanyl analog, now if you were present during Dr. Stavros's presentation at the Opiate Summit, he explained fentanyl analogs. So during 2021, there was none 18 and below, and the highest rate for the analogs was 4, and that was age 35 to 50. I'm trying to cover some opiates so you get a picture. Morphine. So when somebody takes an opiate like heroin, how it processes through the body can show up in a medical examiner's report as morphine, because that's how the body processes it, and that's how it may show up in her report. So just to make that clear, somebody may have used heroin, but it's going to show up as morphine after their death. You'd have to talk to the medical examiner more on that. So there was none under the age of 18. The highest rate was age 35 to 50. Oxycodone, again, there was none below the age of 18, and the highest rate was 50 and above. And I want to give you a little bit of just a bigger picture also. Cocaine was none below the age of 18, and the highest rate for cocaine death was 34, and that was over the age of 50. And heroin was none under the age of 18, and the highest rate was 50 above, and that was 16. And interesting enough, which I was just on a call this morning with the state prevention committee, and DEA is reporting an uptake of methamphetamine. I know we're focused on opiates here and fentanyl, but we are seeing an uptake of methamphetamine across the country with overall deaths. So for us in 2021, there was 1 18 and below. The highest rate of death for methamphetamine was age 35 to 50, and that was 87. But age 26 to 34 was 49, and age 50 and above was 67. So our methamphetamine rate actually is really high, and Mr. Tercel also reported on that. I know it's a lot of information. I can put together a slideshow for you. We also, the state of Florida does what's called the Florida Youth Substance Abuse Survey. So every 2 years, we're able to get adolescents self-report on their substance use as accurate as we can get it. So I have that data as well. A lot of information, sorry guys.
Thank you.
So I tried to pull it all together really quickly this morning.
And thank you,
Any
Denise, for that.
questions?
Any questions?
Not a question, but I think it would be helpful if you could just kind of summarize what you gave us so we could have it as part of
Sure.
the record for sure.
I'll get it
That we
out
could
to
look at. With
Yeah.
that. And again, I think it was very helpful information and kind of looking at what this board's primary objective is and looking kind of at the big picture as well. Because I know there's concern about youth for sure. and-
Absolutely.
And what we need to do from a prevention standpoint and as well as looking at what kind of more immediate kind of interventions that need to be addressed. So again, I think that data is very helpful.
Yeah, it's, our youth are our future, and we're not, I would say, not seeing as many overdose deaths, but that doesn't mean that they're not using. Most individuals, I would say, that you talk to in recovery, they didn't start out using an opiate. They start out using another substance. Anecdotally, I do know in Santa Rosa County, we've had a 16, 13, and a 19-year-old. Anecdotally, again, the ME's report hasn't come out. They passed away. We're anecdotally thinking it was fentanyl, but the fentanyl was in their vape. So, there's a lot of moving parts here to prevention and reaching our adolescents. Laura mentioned community discussions. We partner with the Sheriff's Office and done multiple community discussions. I did one last month at Brownsville. But I hate to tell you, we had 5 community members show up. And that's been my experience. We are working on bringing community members out. It's just getting them to the table. So how do we look at that at a different picture? We've really got to go to them, where they're at. But that's a different type of challenge in a lot of ways. Having those conversations with the faith community. We have done that, and we're still working on that boots on the ground. So, any other questions?
Yes, ma'am. One question. I know we try to reach the adult side of things a lot of times, and that's great from the advance, from the community leaders to the faith-based leaders to all the professionals. However, have you all did like a youth summit to where point to kind of like bring them in and, kind of make it kind of like a day event, fun, maybe some things, but the overall message is to get the awareness out as far as fentanyl. Have you all did one of those lately or whatnot?
CDAC has not done that. That's actually, I was just on a conversation call this morning with one of the, it's not the school resource officer, I believe it's Washington's High ROTC gentleman, and we were in that conversation this morning on doing something like that. Actually, outside of school time, we would have to do that, because getting permission from parents and stuff, it can be a little bit more difficult. But no, but that's something that we can work on. Yeah, absolutely, if there's funding available, because everything costs a little bit of money, but usually CDAC and our community partners were able to pull together some things with low cost. So the Opiate Summit, really, CDAC picked up the cost for the luncheon. Every single one of our speakers volunteered their time.
Okay.
And the mayor provided the venue at no cost as well, so.
Well, I know education and awareness is one of our mandates in this and our responsibilities. So looking out in the audience, I see a gentleman that can definitely help you put together a awesome youth and educational summit. He was part of one board over at Cobb Center after the young lady took her life over at Pine Forest. So, and that was a pretty cool and informational event. And
Yeah, Rodney's kids are great.
Yeah,
Yeah,
so-
he had me come out and speak to them, so, yeah.
excellent.
So, any other questions? And United Way, maybe looking at this as a bigger picture for our youth, doing a youth summit would be probably very powerful, and have those individual testimonies. That's what goes. Also, for the past, I don't know, since January, I worked with the youth, the city council, the city youth advisory and I worked with them, and they were looking at doing a campaign on substance use awareness. So those youth I've been interacting with since January.
Thank you, ma'am.
You're welcome.
Kathy, you have some? Okay, thank you, Denise.
Have any?
Appreciate that. Okay. Is there any new business to come before the committee today, advisory board today?
I don't know if this is actually new business. I guess kind of a question, and I kind of raised it the last time we met in terms of kind of where do we go from here? And I think early on, we got some presentations from the county in terms of what the process would be if we're actually going to solicit proposals or whatever from the community. So I think at some point, we really need to take a look at how we're going to expand the opportunity and awareness in terms of what it is that we're looking for proposals to fund. And so I don't know what that forum needs to be for us to have that discussion or make that decision. But again, I think we've heard about different aspects of the problem, different kind of things that are in place. And we've gotten just a couple of requests basically from the county services for funding. But at this point, we've really not kind of laid out to the community what it is our priorities are, what areas, whether it be prevention or treatment or whatever, that we're looking to fund. So at some point, and again, structurally, I don't know how we have that conversation or when we have that conversation, but I think that's certainly something we need to discuss.
Fortunately for us, I think early on, there was a number of organizations that came forth and kind of laid out their, just as the chief just did, kind of laid out their needs in advance, like the director of EMS, with the mandate that he's asked coming down, and that's a heavy lifting that he's doing, that he's kind of, early on, kind of laid out what he's trying to do and how much it'll cost, and he did it kind of like early before we even kind of got any funding in. But he's definitely on my mind as far as someone I think we could definitely assist. And there's other organizations that has come, and I think we just, with putting priorities together, but we look at the ones that are saying, hey, I'm here, I'm willing to help, and I'm ready to go. We have some that's already here. Gentleman Rodney, he's come pretty much every meeting, laid out that he wants to help in every capacity that he can. And so I think we look at who's already came before us and see how we can assist them in helping us solve these issues, and how we move forward and construct. As a young lady from United Way, she had a lot of information. And sorry for my tardiness. I came in kind of like halfway through, but I was listening to your bullet points of the sectors of involvement. And it's so funny that you come and actually give that thing, because that's what we talked about the last meeting, was the coordination between a lot of the entities that are already doing things, but just bringing them together around the table and saying, okay, let's see how we coordinate this whole body of work together so we don't duplicate services, so we're not wasting resources. And so you kind of reiterated that today. And so, some of us have kind of like different ideas of where money's, and I think it's all kind of like equally weighted. Some looking at prevention, some treatment. My heart is more kind of like on the youth level and education awareness and treatment. But I think we can kind of chew bubble gum and walk at the same time and across the board.
I just wanted to say, as far as getting the community involved, one of the things, Denise, maybe getting some of the feedback as they've gone to some of the community events. I attended the opioid summit, and I thought it was great. I wish everybody could have attended that. I think we need to have more of those in the community. You do want to get community buy-in. Like I said, I have presented previously how some other communities have reached out with surveys to hear from those in the community what their priorities are, breaking it down into treatment or more on education, those type things. I think that may be one area that, you know, we need to pursue a little bit more on that, but also taking the big picture approach and getting that data from Denise, and each of us taking the time to review some of that and then coming back with what our suggestions are as far as moving forward. I know ultimately we'll have to have an RFP process, request for proposals, that the county will have to put out there. I've also looked at what some other counties in the state of Florida have done as far as what their RFPs, and I can send that information to Tina to send out to the board again to let you guys look at that.
I have a question.
Yes, Denise?
So the question I was looking at, because when you were talking about funding, so example, when I was working with the youth at, with the city, and they wanted to do a big media campaign, and we were trying to figure out how to do it for free, because they really want to do it social media. I think we probably figured it out. But, so the proposals on things like that, on prevention or intervention, so funding-wise, do you want those proposals to wait for RFPs, or do we, as just not CDAC, but like other agencies, United Way, we submit those financial proposals like what Sheriff Simmons just did? So I guess that's my question. How are we going to engage the community about the funding that is available, and the agencies that are already working on it? How do we collaborate and let you know what those funding costs would be? I guess. Big question, sorry.
I know, I'm not sure if the county, and that's true, I'm not sure as far as,
So if you look in your bylaws, it talks about duties and funding, and in there it specifically refers to how to handle the use of Chapter 46 in the Code of Ordinances for the solicitations for programming and services. So you want to look there. We can have someone come back at your next meeting and talk to you more about, you know, to remind you. I know it was early on, but you certainly have to go through the procurement process. The other thing is that there is Escambia County regional funding under Section 2 that would allow funds to be used to enhance current programs or develop new programs, as long as it doesn't supplant current funding sources and general funds of the county. So that's where I've been looking at what the sheriff was asking about, and I wanted to make sure that we were, you know, and I did hear the question, is it a sole source availability, which assists in that, making that decision. So if you want to look through those again, then you want to go back, and you also want to look at your A and B that's also available on our website. If you haven't visited our board website, you can go and you don't even have to have that spiral notebook in front of you. You can just pull it right up on the Schedule A and Schedule B. It's laid out there. So those are some, keep in mind, you want to stay within those parameters when you make these decisions of what you want to do. And of course, like I said, we can have someone come back to help you and at the next meeting, but it's a matter of getting everything over to Tina Arroyo in time so that she can get out an agenda. And I know she has, she sends that notice out, I think, a week prior. And I don't, so if you, and it doesn't mean you have to wait until she sends you the notice. You can email her at any time with anything that you want on the agenda, and it doesn't have to wait till she reaches out to you. Feel free to reach out to her. She may kick me under the table for that, but I know that she would be okay if she heard from you with agenda items ahead of time.
Okay, thank you, Christie, for that. I would like, and I don't know if it's now time to do it or not, but I would like to have purchasing come back again, if they could, at maybe possibly the next meeting, and enlighten us now that we have a little more background than we had when they came the first time, but to kind of give us a refresher on that. And also, if we could get Mr. Trussell from EMS, if he could come back and give us an update, just a short, you know, it doesn't have to be as long a presentation as it was before, but just a short update as to the fatigue factor on their people and what we could do and maybe to help that along with any other first responders as far as that goes. So with those two things, Tina, if you could try to take care of those, that I appreciate that. And I guess next thing now is to set the next meeting unless somebody else has something they want to talk about.
I just, one question to you. If we have agencies already at our disposal that are already knocking it out, as you say, the bylaws state, and they can help us in these situations that we need help in already, do we really have to do an RFP for everything that we do?
Well, we certainly have the county's purchasing policy that we have to follow to the T, so.
Correct. So if you're trying to reach beyond anything that's outside of the county, we can support county programs that are in the county over and above what they're already expending. But you have to be careful when you try to create a position because you have to be able to fund that position in the long run. And these funds will run out. And as you can hear, as you heard, it was a $490,000 ask. Is that what that? Yeah,
So we're-
490,000. It'll go fast.
Were we out of bounds when we voted to help the sheriff department right then?
That's something that Wes will go through and make sure that everything, if it can't be presented, he'll be back.
Okay.
But no, you have to make the recommendation and able for him to even look at it.
That's what I was going to say. It's our recommendation. If he
Okay.
decides not to move forward with it, or, there's something that needs to be done procedure-wise, then, we'll have to come back and maybe readdress it, so.
Okay.
But anytime you want to support groups that are outside of the county, then you'll need to do the procurement process, which means there has to be a solicitation, has to be basically a blind solicitation, and you'll have to meet with somebody from, is it your office? You'll have to meet with somebody from purchasing and able to get those bounds set up, and we'll have somebody here next time.
Now, when you say outside of the county, you're talking about Escambia County, right?
I mean, outside of government.
County government, okay.
The government,
Yeah.
Okay, all right.
All right, with that being said, and putting a lot on Tina trying to get this together, let's look at a meeting possibly in August. How does that look? Skip July and move to August toward the latter part maybe? Or the first part, I'm sorry. The Mondays usually work better. I know this was a holiday, but this weekend, but Mondays do work better, I'm assuming.
Mondays work better for me.
Okay. What about Monday, August the 7th? How does that look?
Looks good.
That's good for me.
Okay. All right. Next time? 10 o'clock, work?
Yes.
All right, with no further business come before us, the meeting is adjourned.